Okay, so I just received orders from the healthcare provider that I need to place an NG on this patient. So I'm going to gather all of my supplies, go introduce myself to the patient, and begin the procedure. Hi there, how are you doing today? My name's Audrey, I'll be your student nurse this evening. I am here to place an NG tube in your nose. I'm not sure if the doctor came and saw you, but he did place an order for an NG tube. I understand that your stomach's been super upset, so placing the NG tube will give your bowel a rest and hopefully it'll be able to heal itself. So the first thing I'm going to do is just confirm your name and date of birth. Scarlett Smith, 2/13/1977. Okay, great. Alrighty, Miss Scarlett, I'm going to sit you up just a little bit higher. There we go. Okay. Alright. Now I'm going to do a couple pre-procedural assessments. I need to listen to your bowel sounds. I need to listen to your lungs and assess your oxygen. So just bear with me here for a second and we'll get you moving. Do you have any questions thus far? No? Okay. So first I'm going to put this SpO2 machine on. It's just going to read on your fingernail and it's going to report back what your oxygen is saturating at. Alright, and while we're waiting for that to kind of warm up, I'm going to start listening to your bowel sounds, okay? Alright, now this might take a few minutes, but just hang in there, breathe as you would normally, and we'll go from there. Alright, next I'm going to listen to your lung sounds. I'm just going to have you scooch forward a little bit so I can get this gown out behind you. There we go. There we go. So go ahead and take some deep breaths for me. If at any moment you feel lightheaded, go ahead and let me know and we can take a break. Alrighty, so your lungs sound good, but I wasn't hearing as much activity in your abdomen as we'd like to, so I think placing that NG tube is going to help alleviate some of that pain and hopefully get your bowel rested and then get it moving again. So we are going to go ahead and get ready for the procedure. I'm just going to check a few more things. I want to look at your nose, look at your mouth. I'm going to place this towel over you just to keep your gown nice and clean. And then if at any moment you start to feel nauseous or like you need this emesis basin, it's here for you. So I'll just place that in reaching distance for you. Okay. So I'm going to wash my hands again and put some gloves on. And actually I'm going to just put a few pieces of tape on my workstation here. Alright, so I'm going to look in your nose. Alrighty. And I'm going to check your gag reflex, okay? So you let me know when you feel like you're going to gag. Oh, right there? Okay. Alrighty, so I'm going to pour some of this sterile water over here, and I'm just going to get my workstation all set up. I have some water here for you. That I might offer you some water while I'm placing the tube, and that might help you get the tube down and in place. So we will be sure to use that. Okay. So the first thing I'm going to do is measure the tube. I want to make sure that I'm placing it at an appropriate length. So I'm going to measure from the tip of your nose to your ear, and then from the tip of your ear down to your xiphoid process. So that's looking about 54, and then I'm going to add 10. So I am going to check for patency of the NG tube before I place it. So I'm just going to pass some sterile water through the NG just to ensure that there aren't any obstructions within the tube itself. Okay, so I'm going to put some lubricant on the end of this tip. I did notice when I assessed her nostrils that she has a bit of stuffiness on the right side, so I'm going to use her left nair to insert the NG. Alrighty. I'm going to keep monitoring your oxygen while I place this NG just to make sure that you're satting at appropriate levels. Your oxygen looks great right now, so we'll just aim to keep it there, okay? Alrighty, so I'm going to start placing this down your nose, and I'm going to put my hand behind your neck, and then after about a few centimeters of passing, I'm going to have you tuck your neck into your chin, okay? Alright, are you ready? Good. Right about our 64 mark that we had talked about. How are you feeling? Okay, great. Alright, I'm going to tape this to the patient's cheek just to ensure that it stays there for the time being, and then I'm going to tape it to their nose. Are you still doing okay? Good. it's hard to get this tape on with the gloves. Sorry about that. There we go. Okay. Alrighty. So to make sure that I have the tube in placement, I am going to do 2 checks. The first thing I'm going to do is I'm going to pull a little bit of that content out of your stomach, and we are going to test the pH of it, just to make sure that the pH is acidic. That would indicate that it is in fact in the stomach. So I'm going to put this little test strip in. And while we're waiting for that, I'm going to listen to, I'm going to put a little puff of air in your tube, and I'm going to listen to your left upper quadrant, and that is going to, if I can hear that puff go through, that's going to indicate that it is in placement. Now that's not the only verification method that we'll use. You'll also get a chest x-ray, but all these measures are just going to help ensure that we did in fact place it in your stomach. Towel. I'm going to raise your gown a little bit. Like I said, we'll be using the left upper quadrant. Okay. Ready? 1, 2, 3. Perfect. Alright, and that test strip looks like it's acidic. It's coming about a 3, so I think that helps solidify our placement. Now I'm going to set you up to suction. Are you still doing okay? Are you finished with this emesis basin? Do you think you'll need it? No? Okay. Your oxygen's still reading okay. Alright. So I'm going to come around and hook you up to suction. The healthcare provider ordered intermediate suction, so that indicates between 80 and 100 millimeters of mercury pressure, or suction. So I'm just going to hook this up over here to 80. Okay. I'm going to get my workstation cleaned up here. Do you have any questions? At this point, we're just kind of waiting for x-ray to come in your room, and they're going to do your chest x-ray. That's going to indicate that the tube is in fact in your stomach. So it looks like your oxygen is looking great. I'm just going to wash my hands here. I'm going to take this SpO2 machine off of you, okay? Just in case, I'm going to put these gloves back on in case there's anything that got on the patient's towel here. And then I'm going to put a piece of tape on the gown. Make sure that it stays attached to you. Okay, the last thing I do before I leave, I'm just going to listen to your belly, and I'm going to listen to your lungs again, just to see if I hear any changes. Peek at your lungs again. okey-dokey, everything sounds good to me. We are just gonna wait until that x-ray team comes in and we'll go from there. So let me hand you your call light, and if you need anything at all, I'll just be down the hall, so give us a buzz, okay? Alrighty. So I would leave the patient's room. I would make sure that the bed is all the way down as it is. I would make sure that the environment is clean, it is safe. I'm gonna document in the chart that I placed a Salem sub 14 gauge French stomach tube, NG tube, in the patient. We reached about 64 centimeters in the placement, and it was in the left nair. The patient tolerated the activity pretty well. We are waiting for x-ray, and I will touch base with the patient once we get that chest x-ray.